Run a medical practice in Florida right now, and you know the quiet crisis happening at the front desk. Keeping the administrative operation running smoothly has become incredibly difficult because staffing is entirely unpredictable. The Medical Group Management Association tracked this. In 2022, front office support staff across medical practices hit a 40% turnover rate. Almost half of all administrative teams had to be replaced within a single year. Constantly replacing front desk staff is a severe financial leak. It directly drains the revenue your practice works so hard to generate. And the pressure of that empty front desk does not vanish. It moves up the chain. When the administrative team is overwhelmed, the leftover scheduling, follow-ups, and documentation inevitably land on the physician. We can see this shift clearly in this chart based on American Medical Association data. It breaks down the average physician's 57.8-hour work week. Notice this specific segment here. 7.3 hours every single week are lost entirely to administrative tasks. Digging deeper into that segment reveals the heavy lift of prior authorizations. Physicians process an average of 39 authorizations weekly, eating up 13 hours of their time. And when this paperwork gets delayed, the AMA notes that 80% of patients will abandon their delayed treatments entirely. Over 40% of physicians report burnout symptoms today. That exhaustion is the direct result of a broken administrative loop that compromises patient care and grinds down the providers trying to deliver it. Practice owners usually try to solve this by hiring again, but standard budgeting for local administrative staff relies on a highly misleading number, the base salary. This chart illustrates the trap. A typical mid-size practice expects to pay around $35,000 for a new administrative hire. But once they are on the payroll, that actual expense expands rapidly to a true loaded cost of about $60,800 per year. That jump happens because the base wage ignores the hidden multipliers. When you stack on the required benefits, payroll taxes, physical office space, hardware, and the heavy operational drag of training and eventual turnover, the cost nearly doubles. Relying on local in-house hiring hides these financial liabilities, making every attempt to expand or stabilize the practice artificially expensive. There is an alternative approach gaining traction across Florida. Instead of repeating the local hiring cycle, practices are scaling their administrative operations with dedicated virtual medical assistants from specialized providers like Staffingly. For this to actually work, it requires deep integration. These virtual medical assistants do not use external workarounds. They connect directly into the practice's existing electronic health record system, operating exactly as an in-house team member would. Because the system is pre-built, an integrated virtual assistant can go live in 48 to 72 hours. That entirely bypasses the typical 4 to 6 week lag of onboarding and training a local hire, and it operates under rigorous enterprise-level security frameworks. The infrastructure maintains strict compliance with HIPAA, SOC 2 Type 2, ISO 27001, and HIT Trust standards. This is a plug-and-play operational upgrade that provides guaranteed workflow stability, right out of the box. The speed of this model comes from how it handles data. Staffingly layers AI-powered automation directly over the human workflow, processing massive amounts of repetitive paperwork at high velocity while maintaining absolute accuracy. For instance, natural language processing automatically scans incoming patient documents and referrals. It extracts vital information and pre-populates fields in your EHR system before a human ever has to type a single word. Meanwhile, automated duplicate detection systems constantly monitor the inputs. They preemptively flag redundant entries, catching issues before they can turn into downstream billing errors. By handling the sheer volume with AI and leaving the critical thinking to dedicated human staff, the workflow output consistently outpaces what an overwhelmed local front desk can produce. This chart compares the bottom line. On the left, the $60,800 loaded cost of an in-house hire. On the right, the $21,600 cost for a Staffingly virtual assistant. That's a guaranteed 64% reduction, immediately returning $39,200 to the practice's bottom line per position. Solving your staffing crisis is a clear financial arbitrage opportunity that protects your profitability and your provider's time. Visit Staffingly to schedule a risk-free 15-minute consultation and map out exactly how much your practice can save.